Happy New Year 2026. We're 3 days in. Welcome to the Home Health Care Today show. That's right. We have gone from podcast to broadcast. This is a new TV show in a new year. It's all about your health, your coverage, and your year. More than half of Americans, 56%, say they feel completely lost when it comes to understanding their health insurance. Today, the Home Health Care Today show is here to change that. Our distinguished guest is Patty Graham. Patty is president and CEO of Meridian Health Plan in Michigan. Patty brings nearly 20 years of experience in Medicaid and government-sponsored programs, specifically serving the Michigan community since 2010. Meridian recently celebrated its 28th year anniversary of serving Michiganders with access to quality care, a milestone Patty has significantly supported throughout her tenure with Meridian. Patty, welcome to our show.
Thank you so much for having me. What a pleasure.
And Happy New Year.
Thank you. Happy New Year as well.
Patty, please talk to us a little bit, share with our viewers out there. What is the Meridian story?
Sure. Meridian has been in Michigan nearly 30 years. We service Medicaid beneficiaries as well as Medicare and some marketplace throughout the state. We have the honor of serving over 500,000 Michiganders every single year. So grateful to be here with you today.
Wow, Patty, thank you for that. So, Patty, we're thrilled that Meridian is the sponsor of the Home Health Care Today show. Home Health Care Today show is more so of a lifestyle show, where we talk about health, we talk about wellness. We dive into some of those topics that may be a little difficult to discuss in the exam room, but if we can give folks a journey through their health decisions every Saturday morning at 10 o'clock, we're doing our job. Patty, why Meridian? And why did you all decide to sponsor the Home Health Care Today show?
Certainly the decision was easy, partly because we're aligned very similarly
Yes.
in the way that we service our communities. I'm thankful to have staff across the entire state, but also in this great city. As we think around not only the support of Michigan, but the impact that we have in our communities, we have a mission to service our communities one person at a time.
Absolutely.
And I think our missions are very aligned, whether it's education or support of one another, support of our neighbors, the members we serve. It's really about education, support, and the care.
We're so grateful, Patty. Thank you so much, to talk about these, challenging, topics as related to health. It is so great to have a partnership, and to partner with an organization like Meridian that's boots on the ground in the community, in the streets, all around the state of Michigan, folks, for sure. But Patty, we'll bring it back home. All right, so it's a new year. Folks are looking at the back of their health cards. They're getting, notices in the mail, and they're wondering about their plans. There's a lot of folks that do have the Meridian Health Plan. There's folks that have Better, which is a product, and they have WellCare. How do you figure out the difference between your plan and the coverages here in the new year?
Sure. So Medicaid is service to underserved and folks that meet certain criteria from an income perspective. Medicare is those 65 and above, and then also certain health conditions. And then the marketplace, Better, is an individual product that you can purchase on the exchange.
Oh, yeah.
So a little bit of differences. And then really importantly, you could also be a dual member. So you could also have Medicare and Medicaid together.
Yes.
So those are those options.
Got you. All right, Patty, we're on this topic of insurance, those Advantage plans. There are some folks that have those too. How do they play into this conversation?
Sure, certainly. The great thing about America is you get the choice.
Yep.
And so Medicare Advantage programs are programs run by other entities outside of the federal government, but support the members navigating through their healthcare journey. And so I'd encourage folks to take a look at not only the benefit packages, but also the value-added benefits within each of those
Oh, yeah.
As I think around the way they select services and coverage.
Got it. Okay, so new year, new benefits. I Care for Detroit, I Care for Michigan is close to our hearts. Vision plans and dental plans, right? What's new here in 2026 in terms of coverages, all those
Sure.
special plans?
Well, when we think about Medicaid, it's a wonderful that the state of Michigan is aligned with coverage for dental services and vision services. Medicare as well, there's many plans that cover those services. I think it's also important as you think around our partnership with I Care for Detroit and the mission to service over 40,000 homebound Detroiters.
That's right.
There's an opportunity as we think around not only selection of the plan, but the ways the plans engage with their membership.
Yes.
So meeting a member where they are, making sure we're listening very well to the community need.
Yep.
So I'm thankful to not only be here for the discussion around health, but also in the partnership with the great passion that you've got for service to membership.
Likewise, Patty. Thank you so much. So I appreciate the love and the partnership that we have. Okay. In this topic of, health and wellness, there's folks that say, but I need transportation. I need durable medical equipment. I got a lot going on. Better yet, I just need food, right? And nutrition as I begin to think about my ailment. And then I got some adults out there that are taking care of seniors to say, kind of need some incontinence supplies, right? What are some hidden gems, Addie? Hidden gems that, Meridian has and brings to the table?
Sure. I think that the hidden gems are often utilizing the benefits that you've got. So if you have Medicaid, the wonderful thing about the state of Michigan and the support of the membership here is that if you've got Medicaid, you have transportation coverage. You have not only the vision and hearing, but you also have supports and services around something they call social determinants of health, which is housing.
True.
It's food insecurity.
Spent some time there, Patty.
Yes.
Yeah.
So if we think about the way that you navigate, whether it's you or it's your neighbor or your child navigating health coverage, the great thing is that every Medicaid health plan has the ability to help support you.
Yes.
So I'd encourage folks to give a call, understand your benefits.
Yep.
I also think that the importance of using the collection of community-based organizations and the referrals that happen. The great thing about this community is you've not just got your health insurance, but also you've got the community supports around that they help partner with. So referrals and support for those kinds of services.
Absolutely.
And I think the other part too is it takes, as we think about navigating systems, it depends on systems and it depends on seasons in life. So different circumstances change what you need. And the great thing is all these services are provided.
They are, Patty. Yeah, so we got a little more time in our segment here before our commercial. So speaking of that and understanding that we take care of a wide variety of Michigan residents, can you talk to me about some of the programs that you have for folks of all ages? Because, we were just out last summer and we were taking care of kids. Like it was August and we were doing this back to school vision screening and we did backpacks and just general health and wellness check-ins. Let's talk about the youth and some of those other segments.
Sure. We really think it's important to engage not only from how a member navigates healthcare, but also the community of need. So some of the programs that we did with the schools were based on a community assessment where schools said, hey, we could use some support here. We've also done some great programs around how we deploy our nurses. We've got hundreds of nurses and community health workers that actually work for Meridian and then also for partnerships that'll go to members' homes to make sure you get the services you need. When you think about a follow-up after a hospitalization, making sure you've got not only your medications, but also you got a safe home.
Yep.
So as I think around the support and services, it doesn't start and stop at claims payment. It's really about whole person care and making sure people get what they need.
I love that. I love that. The kids, we talked about transportation, food, knowing your coverages. So that 56% of Americans that are a little unclear about their health plan, if they were here in Michigan and had a Meridian plan, they would be 100% clear, Patty, about their plan and some. So grateful and appreciative. Patty, is there any closing remarks that you would like for the audience to hear and to know?
it's just a privilege to not only be here, but continue the conversation around how we all navigate healthcare. I think it's difficult as a normal consumer sometimes to understand who's in network, how to navigate your services, to understand your benefits. Call your plan, make sure that you understand it. There's advocates that also help throughout the community and then also within the plans. So thinking about care management and the support around that, really important.
Absolutely. So it reminds me of the one Detroit, the one Michigan, and Meridian Health Plan in Michigan, bringing it all together. And in terms of homebound, there's like 100,000 homebound residents in the state of Michigan. So knowing that Meridian is a leader and a beacon in the state, regardless of what plan a person has, hey, look at the back of that card, and when in doubt, feel free to reach out to My Meridian. So mimeridian.com. Patty, it has been such a delight to have you on our show.
Thank you so much.
Thank you. And I look forward to continuing our partnership and bringing you back on for future episodes.
Likewise.
All right. Enjoy the rest of this beautiful new year.
You too.
Thank you, Patty. We went from podcast to broadcast. The Home Healthcare Today show is back. I'm your host, Dr. Cleamon Moorer. The show is sponsored by Meridian Health Plan in Michigan. Stay tuned. Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today. The Home Healthcare Today show is sponsored by Meridian Health Plan in Michigan. Meridian Health Plan in Michigan is Michigan's largest Medicaid HMO, providing care to over 500,000 Michigan residents. Meridian also offers products and services to the senior community. Their WellCare program is another HMO that provides care. But our program, the Home Healthcare Today show, brings content to households all throughout the Southeast Michigan area and beyond by following the Home Healthcare Today show on YouTube. We have content and topics for all realms and walks of life, from pediatric care to maternal health to adolescent care, mental health topics and the like, all around health and wellness you'll find on the Home Healthcare Today show. Watch us every Saturday morning, 10 a.m. Hey, welcome back to the Home Healthcare Today show. Yes, the lifestyle show where we dive deep into health and wellness topics. In that first segment today, you all heard from Patty Graham, President and CEO of Meridian Health Plan. The Meridian crew and the bench is really deep, right? Today, in this segment, we have the Chief Medical Officer, Dr. Alvin Haynes, to join us. Let me tell you a little bit about Dr. Haynes. Dr. Haynes serves as the Chief Medical Officer of Meridian Health Plan. In this role, he leverages his extensive experience in healthcare management and clinical practice. He has been a hospitalist for over 20 years and has held various leadership positions in physician group management, indicating a strong background in both clinical and administrative aspects of healthcare. At Meridian Health Plan, Dr. Haynes is involved in overseeing medical strategies and initiatives that align with the company's mission to provide high-quality healthcare services. His role likely includes collaboration with various stakeholders to improve patient outcomes and optimize healthcare delivery systems. Dr. Haynes, welcome to the Home Healthcare Today show.
Thank you so much.
Doc, well, once again, another pleasantry. Happy New Year, 2026.
Happy New Year to you as well.
Hey, we're here. Doc, do you mind sharing with the Detroit television audience out there, what was your path to medicine?
Yeah, so my path to medicine started in childhood. I had a mother who worked at the VA Medical Center in New Orleans for about 25 years.
The NOLA.
Yeah, and she worked as a lab tech, and she was a woman of color in the 1960s, had dreams of going to medical school, but unfortunately at that time, opportunities were limited. And so she probably introduced me to medicine. I had an aptitude for science and mathematics, and and decided pretty early on that I wanted to do that. And also with really wanting to help people and helping the community.
Yes.
I thought this would be the best way to go about leveraging it, and ultimately went through college, got all of my prerequisites, went through 4 years of medical school, went through 3 years of training in internal medicine, and became a physician.
Well, well, congratulations, Dr. Haynes, and congratulations for, having a mom that had the vision and that vigor to inspire you to pursue medicine. So,
absolutely.
Yes, wonderful, Doc. Well, with that being said, talk to us about your current role. When people think Chief Medical Officer, hey, let's talk about that role. And welcome to Detroit, because, hey, Detroit's a very special place, man. So,
Detroit is a very special place, if I could add. So Detroit reminds me a lot of my hometown of New Orleans.
All right.
In my short time here, I've really felt the warmth of the people of Detroit, the pride that they have in the city. The fact that we recognize that we have some opportunities in Detroit, but people are really optimistic about changing the city, and you can certainly see it reflected in the things that are happening. So I'm very, very excited about being here. So if I can go back a little bit through my career, so I've kind of worked as a doctor, which is called a hospitalist. So I take care of adult patients when they get sick in the hospital. If some of our viewers have been in the hospital, I may have been the physician that was taking care of you and coordinating your care in the hospital.
Yes, sir.
And so I did that. I've done that for 20 years, but I've also led other physicians who do that.
Wonderful.
I've led hospitals as an administrator in the hospitals, ensuring quality of care. And now in my role as Chief Medical Officer for Meridian, it's quite similar to what I've kind of been doing throughout my whole career. And that really is to leverage a team of clinicians, a team of experts to really try to bring the best of care to individuals and to our entire population. And so I kind of serve as the what I would call the quarterback.
Yes,
and we have a team of utilization nurses. We have care managers who are seeing our patients out in the community.
Yes.
We have quality of care nursing staff who are ensuring that our members are getting the right care at the right time. And it's really a privilege to lead such a wonderful team of really experienced clinicians.
Fantastic, Dr. Haynes. Well, there's a segue in there. You mentioned the quarterback. All right. So as a partner, we are, American Advantage Home Care and also Eye Care, Eye Care for Detroit, So we take care of a lot of homebound individuals for sure, right? So whenever you think about, home health, why does home health matter? Does home care matter?
Well, as a person who's had the opportunity to be a physician who've worked in nursing facilities, home care is just a game-changing place to receive care.
Yes.
Home care, home is where you're quite comfortable. I think one of the opportunities that our nurses and our physicians who treat our members in the home, they really get to see the patients in their own environment with their loved ones, the challenges in that environment, the things that can be leveraged for the good in that environment. And so what I think home care really offers is it really allows for a spiritual sort of comfort for that patient that really promotes healing in that environment. Additionally, I think what we can also do is leverage resources in the home to try to keep patients out of the hospital, to try to keep patients out of these facilities, to really allow people to continue to live their lives and receive the support that they need.
Awesome, Dr. Haynes. Well, hey, as we think about our audience out there, there's like caregivers. There's so many individuals, that are tuned into Channel 20, watching our show. Folks are picking up some of this content via YouTube and then, of course, podcasts, wherever podcasts are distributed. So a lot of helpful information. It's a new year. What can we prevent? As you think about prevention, and we take on so many topics. What's a good message as related to prevention of various diseases or ailments or the progression of certain diseases and ailments?
Yeah, certainly. I think all of those things are really ripe for prevention. I think it all starts with ensuring that you're visiting with your primary care physician at least one time a year. And if you don't have a primary care physician, ensuring that you get a primary care physician, because the primary care physician is really expert on all of the screenings for your age. And so whether it be if you're a man who needs to be screened for prostate cancer with a simple blood test called a PSA, whether you're a female who needs a mammogram on a yearly basis to help prevent breast cancer, whether you're a diabetic to get your blood tested to see if your sugar levels are in adequate control, or if you need to get an eye exam on a yearly basis to ensure that the diabetes is not affecting your eyes. So for all of those reasons, you need to be preventive. Now, there's also a lot of, we're in the wintertime now.
That's true. Yeah.
And so there's a lot of confusing information kind of coming out about vaccines. Should I get a vaccine? Should I not get a vaccine? What we will say is that the science really does support vaccination, especially in our elderly populations, because they are certainly at much higher risk in general than the normal population. And so we recommend that they get flu vaccinated and COVID vaccinated for our high risk population. So it's important to try to get information sometimes from specialist medical societies that really give that information, and they continue to support those recommendations in our senior population.
Absolutely, Doc. Hey, that is really helpful information for sure. Doc, there's still some folks that are out there that are saying, how do I navigate the system? You mentioned primary care physicians. You talked about, hey, I need an eye exam perhaps. You know, hey, I need to get a flu shot, right? So talk to us, give a little advice for folks when it comes to navigating the system, you know, from a doctor's perspective.
Yeah, you know, navigating the system can be tricky. You know, what we try to do as at Meridian is really try to provide support for our members to be able to navigate that system. I think our president spoke about that in her segment. We really have resources like care coordinators at our plan that can really help to answer those questions about where do I go, regardless of what type of plan you have, whether it be Medicare or Medicaid or Ambetter. Really, we encourage you to call your plan. Additionally, on our website at MyMeridian, mimeridian.com, we have a wealth of information for the type of health plan, navigating, it says, for patients, and can tell you where to go to get that information. So we really encourage you to engage with us because we're trying to keep you healthy.
Absolutely. So. Hey, and you all are doing a wonderful, wonderful job of doing it. You know, Meridian, care above all else, you know. Doc, so you don't have your prescription pad with you, I take it, right? But as we think about loading our year here and the calendar of health events, so all throughout the year, every Saturday, the Home Health Care Today show is going to, you know, tackle a lot of different topics. You know, when you think of next month, February, we're going to talk about heart health, right? Fast forward to April, like minority health awareness, right? May, Women's Health Month. June, Men's Health Month. I can go on and on with this, right? A lot going on for folks out there. Doc, without the prescription pad from the top of the dome, could you provide a prescription for listeners and viewers for 2026?
Yeah, you know, healthcare in many ways, it's complex, but in many ways it's simple. Yeah. It's all of the things your mom and your grandmother told you about when you were a kid. Get out and move. Movement is key on a day-to-day basis, whether that be walking, whether that be doing, picking up your legs while sitting in a chair, whether that be sort of squatting up and down in your household. Movement is really important. Sleep, incredibly important. At least 6 hours a night. Most people recommend 7 or 8 hours a night of sleep. And then I think about Michiganders. I came from Florida, so there's a lot of sunlight in Florida.
Yeah,
But in Michigan, sometimes that sunlight can be lacking. So in Michigan, really trying to get in well-lit areas, it can really elevate your mood. It can help to reset your cycles about sleep and wake, and really just kind of make your day. And finally, you know, really just trying to stay hydrated, eating healthy foods. The big thing these days is non-processed food. So that means trying to stay with fresh fruit, fresh vegetables, fresh meat, low fat. So those are my prescriptions for health without the prescription.
Doc, those are excellent prescriptions. The beauty of that is that Meridian Health Plan in Michigan can help members, right, with all of those areas, you know, because the clinicians are there, the support, the partnerships are in place to help mitigate those social determinants of health. So you mentioned movement. For the home health community out there, we could send in physical therapists through American Advantage Home Care, occupational therapists to assist with that movement when it comes to sleep or sleep management. For individuals that are suffering from chronic pain that may have challenges with sleep, we can provide some support there. Daylight, we'll do our best with daylight, Doc, but certainly food and hydration. Dr. Haynes, it has been a pleasure to have you on the Home Healthcare Today show. Folks, stay tuned for next week's episode with Dr. Deidre Claveroo. You won't want to miss it. Beginning January 3rd, 2026, we're bringing a new show called the Home Healthcare Today Show, hosted by Dr. Cleamon Moorer and sponsored by Meridian Health Plan in Michigan. On a weekly basis, we bring in Michigan's top health experts to dive into a variety of health and wellness topics. Content ranging from how do I manage a health complication or an issue? How do I live a healthier lifestyle? Tune in every Saturday morning, 10 a.m.
There's another cold, bitter winter season ahead of us. Thus, allow American Advantage Home Care to come into your home to provide safe, high-quality, skilled nursing and physical therapy services. Choose a home health care team that never, ever drops the ball.
Tune in next week to hear how home health care has evolved since the pandemic.
That's when we were living, more communally.
True.
And we were in touch with our neighbors, and families sometimes lived side by side. But our society has changed,
Certainly.
and we are not able to necessarily depend on that neighbor.
So true.
Or that daughter or son may be working for a longer period of time than they have in the past to make ends meet, and
Amen.
they're not able to take up the slack.
That's right.
So having that other trained community partner,
Yes.
such as a reputable and dependable and compassionate home care agency, that can be your partner.
Absolutely. Hey, you all heard it here on the Home Healthcare Today show.